Hi, everybody. Welcome to my fake podcast where I talk to my coworkers in the office who can help make retirement a little bit easier, maybe answer some questions that you were wondering about. Today, I'm talking with Roger Lusheen, our Medicare specialist. And to be honest, Medicare seems like it should be straightforward, but it's really not. It's very complicated. And I know that there's supplements and there's Medicare Advantage plans. There's all kinds of stuff. So Roger, would you just walk us through Medicare? What exactly does it cover and what
Sure,
doesn't it cover?
sure, I'd be happy to. Thanks, Colleen. First of all, thanks for the introduction. Nice introduction. I appreciate that, and thanks for helping us out with all this. So when somebody turns 65 or getting ready to go on Medicare, there's four parts to what they call original Medicare. There's Part A, and there's Part B, and there's Part C, and there's Part D. And I'm going to explain all four of those just really, really quickly. So when you think Part A, I always tell everybody think room and board. Medicare Part A and covers when you're admitted into a hospital. It basically covers the room and the food that you eat. It also covers skilled nursing care and home health care after a hospital stay. There's some parameters around that that we can get detailed. If you have questions about that, just let us know. But basically, Part A is the hospitalization portion of your Medicare. For most people, it is free. It is based on your work history or a spouse's work history. So there's generally not, for most people, a premium for Part A. However,
So,
if you're not,
so let me just clarify. So what you're
yeah,
saying is it's not necessarily free, but it's something that we've paid into while we were working.
correct, Colleen. So if you're working still and you look at your paycheck and you see the Medicare deduction, that amount of money goes into the Part A trust fund.
Okay, that
Um,
makes sense.
Correct, right. And so for the vast majority of the people, you're going to have your money paid into your Part A trust fund. However, if you are somebody who didn't work and you don't have a spouse that worked, you can actually purchase Part A, but that's very, very rare. Most people are eligible for free Part A. And again, Part A is basically just when you're admitted into a hospital, and then after an admission to a hospital, a skilled nursing facility is also covered under Part A. If you need some rehabilitation services, maybe you live alone, you're having trouble getting around, you had some knee surgery, maybe you need a little bit of therapy, whatever it is, that also is also covered under Part A. Part B, pretty much I always tell everybody covers everything else. You're talking about doctors, you're talking about emergency room visits, maybe tests, um, maybe like I said, an emergency room visit. If you're in a hospital, when the doctor comes visits you, the medications that you get in a hospital. If you are on somebody are on intravenous drugs like chemotherapy or Remicade for rheumatoid arthritis, and those are given in an infusion center. Those are always covered under Part B as well. So medications that you don't get from a pharmacy, your doctor doesn't write you a script and you don't go to a pharmacy and get it, but you're going to a facility, a doctor's office, again, an infusion center, those are going to be covered under Part B as well. And there is a premium for Part B. The Part B premium, the base Part B premium this year is $174.70. And the reason I say Part B base premium is because there's a thing called an IRMA, an income related monthly adjustment amount. And basically what it is high earners pay more. We have a chart for that. We can help you walk you through that. We can also help you with remedies for that if you have a certain situations on that. But basically most people are going to pay $174.70 a month for their Part B. And that's this year's premium, the 2024 premium. And that does change every year. After that, there's what's called Part C. And Part C is what you see a lot of commercials for on TV. There's a lot of terminology for Part C. It could be Part C, it could be called the Medicare Advantage plan. A lot of people in the medical field call them replacement plans. And the reason they call them that, is because technically they replace Medicare A and B. So if you have an Advantage plan or a Part C plan, you're technically on that company's plan, and those are offered by outside insurance companies. And there's a variety of companies depending on your area. And again, we're a broker, so we do represent if not most or all of the companies in our area. So we're able to compare and make sure that you're on the right plan for you. But Medicare Advantage plans, really what they do is they created an alternative to original Medicare, and they'll have a lot of extra benefits included in them. And depending on your area, it might have a free gym membership, it might have some dental, vision, and hearing. But basically, again, they create an alternative to original Medicare. So what I call those are pay me later. They're generally low premium plans, but they have copays, much like the insurance that you had when you're working. They're PPOs, there's HMOs, so you're going to have in and out of network doctors, and they just work a little differently than original Medicare. So back real quick, if you have original Medicare and you don't have a Part C, what most people do then is add a supplemental coverage to it. Supplemental plans, there are a variety of different plans. We can definitely go over those with you, but they're different than a Medicare Advantage plan. What they do is and some people call them Medigap plans. If you've heard the term Medigap, it just means fill in the gaps of Medicare. So if you have original Medicare A and B and a supplemental, we'll be able to walk you through what those rates are, what the plans are available in your area. So that would be as opposed to a Medicare Advantage Part C plan.
So
And then,
really
yeah,
quick, let me just make sure I understand this right. So
sure,
original Medicare is A and B, and it doesn't necessarily cover everything. There's still going
correct.
to be some things that you have to pay for. So because of that, you might want to look into a supplemental plan or an advantage plan to cover
Exactly.
those expenses.
Exactly, and that's a
Okay,
good question. And what those gaps or what those extra things would be are typically going to be deductibles and co-insurances. So Part A has a deductible, Part B has a deductible, Part B also has a 20% co-insurance, meaning Medicare covers 80%, and then if you just had A and B, you would be liable for that 20%. So what most people do is what if they just have A and B and they want to go the supplemental route, then they would add a supplemental to pick up those charges. And depending on
got
the
it.
plan, it picks up certain charges. And we offer all the plans again in our area. And we would be able to, at a one-on-one conversation, have what's best for you. And then if you go that route, so A and B with a supplemental or a Medigap plan, that does not include drug coverage. So you would need to add drug coverage to it. And that's Part D. And Part D is, I always tell everybody, it's probably the most difficult part about what our job that we do, but it's also one of the most important parts of what we do because we've seen where people were on the wrong Part D plan and or signed up for a Part D when they first turned 65 and never changed it and come to find out 4 or 5 years later they're on the wrong plan, costing themselves hundreds, maybe thousands of dollars a year. So we're going to review your Part D plan every year for you, make sure you're on the right drug plan. But basically, Part D are drug plans. They do vary from zip code to zip code. Again, we're licensed with most of the Part D plans in our area. And by the way, our area, we represent Indiana and Illinois. We do have alternative agents throughout the United States, but our main office, our agents write plans in Indiana and Illinois. So Part D is one of the more complicated parts. Really what we do is we have a plan finder that has all the plans available in our area. If we don't represent a plan that's right for you, we're going to let you know that. You can always call 1-800-MEDICARE or go to medicare.gov to see all of the plans. However, our plan finder does have all of the plans. And then what we would do is just lay out based on your medications and your zip code, what's going to be the best plan for you.
And when you say plan finder, I'm guessing that's like some kind of software.
Yeah, exactly
Okay.
right. It's a software that we, again, plug all your information into your age, your sex, your zip code, what medications you're on, the doctors that you might want to see. And that also is true for the Medicare Advantage plans as well. We use the same plan finder, and that's going to help you make sure that we're picking the best plan for you with the most benefits, whether it's a Medicare Advantage plan, a supplemental plan, or a drug plan. So we're going to be able to give you some options, not just one option, but several options, explain all the options to you, and just make sure that it's right for you.
Great. Okay, so now if somebody wants to talk more in depth about Medicare, what should they do?
So the first thing to do would be contact our office. I have two assistants. We have two assistants on our Medicare division, Sarah and Kimberly. And so you would call the number. Colleen's going to have the number of our office at the very end here. And there we are, lovely picture of me. But you would call Sarah or Kimberly and just ask for an appointment to see one of our agents. They're gonna run you through some paperwork that we need, some preliminary information, and then at that point set up an appointment for you to come in for a complimentary review of your entire situation, whether you're on Medicare, getting ready to go on Medicare, maybe you're 6 months or a year away from Medicare, and you just want to come in and find out some information. We're all about that. We want you to get an early start. It's always going to be complimentary to come see us. One question I get asked a lot, as a matter of fact, I got asked today, is how much do I owe you? And for our Medicare practice, there's never any charge. We do get paid by the insurance companies. It does not change what you pay. Those rates are logged with Medicare a year in advance. So I do, one thing I can't stress enough, as I always insist or recommend, that find somebody you trust, whether or not it's us or not, but find somebody you trust to have you navigate this, because we've just touched the tip of the iceberg today talking about the A, B, C, and D. There is so much more to it when you start digging into it. Like Colleen said at the very beginning, it can be complicated, but as long as you're talking to somebody who's knowledgeable and can offer you all the plans, you can make sure to make the best decision for you.
Awesome. Okay, well, I really appreciate you taking the time to talk today, Roger.
Thank you, Colleen, so much, and thank you for your time. And I look forward to speaking to all of you out there.
Awesome. Thanks so much, Roger. Have a great day.
Thank you, you too.